Snoring is fairly common during pregnancy, affecting about 1 in 3 pregnant women. One of the most likely culprits of this sleep symphony is weight gain, which results in extra tissue around the head and neck.
So during pregnancy, with more of a relaxation of those muscles and less space for the air to pass, we can again see more snoring and the possibility of blockages occurring during sleep periods.
Surging pregnancy hormones cause the mucous membranes in a pregnant woman's nose to swell, which can also be an underlying cause of snoring.
During the pregnancy, we tend to see a lot more nasal congestion, which will exacerbate snoring if it exists before the pregnancy, or which can lead to an onset of breathing issues.
Usually snoring during pregnancy is more of an annoyance than anything else, but in some cases snoring can be a sign of a more serious health concern, like gestational diabetes, high blood pressure, or sleep apnea, where you actually stop breathing for a short period of time during the night. This is a serious concern because it drops oxygen levels for both mom and baby.
So very frequent, sometimes times throughout the night, where the mom's oxygen levels are taking intermittent dips. And my concern is what's happening to the blood flow to her fetus.
Pregnant women should consider snoring a warning sign, especially if it's accompanied by severe daytime sleepiness, headaches, and swollen legs. For Lee Memorial Health System, I'm Amy Osher.